What's new from Apple? There's the new iPhone 16 Pro, built for Apple Intelligence. And it comes with the all-new camera control, giving you an easier way to quickly access your camera tools. The new Apple Watch Series 10 has our biggest display and our thinnest design ever. And this? It's the sound of active noise cancellation, now available on one of 2 new AirPods 4 models. So quiet. Check out all of the new products and new features at apple.com. You can even buy yourself something new. See apple.com for product availability updates. Apple Intelligence coming this fall.
With Walmart's new fresh and frozen subscriptions, you can save time on your weekly grocery shopping.
Dad, you're supposed to be grocery shopping.
And miss the chance to embarrass you in front of your friends? I subscribe to snacks and wet napkins. You know how messy you are.
Dad!
Walmart. Subscribe to your weekly list.
Earning your degree online doesn't mean you have to go about it alone. At Capella University, we're here to support you when you're ready. From enrollment counselors who get to know you and your goals, to academic coaches who can help you form a plan to stay on track. We care about your success and are dedicated to helping you pursue your goals. Going back to school is a big step, but having support at every step of your academic journey can make a big difference. Imagine your future differently at capella.edu.
Why did the art collector buy an old septic tank? It's filled with mass turd pieces. Did you hear about the contest to win a ton of cow manure? To the victor, go the soils. What did the father buffalo say to his son when he left for college? Bye, son.
If you just read the bio for Dr. Steve, host of Weird Medicine on Sirius XM 103 and made popular by 2 really comedy shows, Opie and Anthony and Ron and Fez, you would have thought that this guy was a bit of, a clown.
Why can't you give me the respect that I'm entitled to?
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valve, exacerbating my incredible woes. I want to take my brain out and blast it with the wave, an ultrasonic, echographic, and a pulsating shave. I want a magic pill for all my ailments, the health equivalent to Citizen Kane. And if I don't get it now in a tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease, so I'm paging Dr. Steve. Dr. Steve!
From the world-famous Cardiff Electric Network studios, it's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio, now a podcast. I'm Dr. Steve with my little pal, Dr. Scott, the traditional Chinese medicine provider who gives me street cred with the wacko alternative medicine assholes. Hello, Dr. Scott.
Hey, Dr. Steve.
And my partner in all things, Tacie. Hello, Tacie.
Hello.
And we will have Tacie's topic time later.
Ooh.
Oh, no, Tacie's time
Potty
of topics.
break.
I got to be careful not to have a copyright violation from Harrison Young. It's Tacie's time of topics. That'll be coming up soon. And then back from sabbatical, Lydia. Hello, PA Lydia.
Hello.
So good to see you. This is a show for people who never listened to a medical show on the radio or the internet. If you have a question you're embarrassed to take to a regular medical provider, if you can't find an answer anywhere else, give us a call at 347-766-4323. That's 347-POOHEAD. Follow us on Twitter at Weird Medicine or at DrScottWM. Visit our website at drsteve.com for podcast, medical news, and stuff you can buy. Most importantly, we are not your medical providers. Take everything here with a grain of salt. Don't act on anything you hear on this show without talking it over with your healthcare provider. Yeah, very good. So, PA Lydia, you still doing, what was that thing you were doing? Argo Project or something?
Yeah, Allied Extract.
Allied Extract,
yeah.
Yes, very good. So check her out at alliedextract.org.
Yeah.
Oh, very
Thanks,
good.
guys.
Okay. Throw them a couple bucks. No matter what side you're on in that conflict, helping out people who need help is always a good thing. Human beings, not politicians.
Human beings.
Check out stuff.drsteve.com for all of your Amazon needs. Our website now is in a state of flux, but stuff.drsteve will still get you there. And check out Dr. Scott's website at simplyherbals.net. We'll talk about it in a minute. And then Tacie, you and I are doing patreon.com/weirdmedicine. And we've got some big guests coming up. And apparently, I've just read rumblings of this. Apparently, Anthony and Kevin Brennan are on the outs again. And so we're going to have to get Kevin in here to talk about what the hell happened there.
Oh, no.
So, yeah, we'll get Kevin in and maybe Anthony as well. Although I'll be seeing Anthony maybe this weekend in Rochester, New York. Check out tickets at WATPlive.com. There's still a few left. No VIP tickets left, but there are some regular tickets left. And then check out cameo.com/weirdmedicine. I'll say fluid to your mama or whatever you want me to say to her. I do not care. Well, there was one where I said, I don't know if I can say this one, but that was one out of the hundreds that I've done. It's dirt cheap. I just do it for fun because it's fun to do. That's it. And all that money goes into my ham radio fund, and my buddy Dale and I are going to we're going to buy a preamp with that money so that we can bounce signals off the moon and talk to other nerds. Who are doing the same thing. It's kind of cool. Yeah, so use the moon. Look at that look on Tacie's face.
That's really neat.
She just
Don't
looks
encourage him.
Like she just ate a chunk of liver thinking that
sandwich.
It was, or something. Anyway.
Don't encourage him, Lydia.
You haven't seen anything till you see a kite flying on the beach.
With a ham radio antenna.
The ham radio antenna attached.
At the beach.
Is that the plan? Oh, you did that already?
Yeah, and then they left, and then it started raining. So me and the other wife had to try to put it up. We don't know how to put that shit up.
Yeah, why did we leave it there?
It was a disaster.
I don't remember that.
I don't know. You just left it. You just
I think we had to go get something.
And then...
because we'd forgotten a piece of coax or something.
Massive storm comes.
Which happens at the beach out of the blue.
Yeah, quickly, huh?
Well, what we were trying to do is, repeat the Ben Franklin experiment. Flying the kite. I wonder if he really did that. That has to be apocryphal. I mean, surely he wasn't out there holding the kite. I bet you he had a kite, and then he had a Leyden jar that had the little 2 pieces of foil in it. And as lightning hit nearby, he watched the foil move, and that way he proved that lightning is electrical phenomenon.
Yeah, it
has
awesome.
to be that. But this picture of this guy standing out there holding a kite on a string, I think that's not how it really worked.
In June of 1752.
What does it say?
It just says he
Does
was,
it say what
he
the
was
mechanism was?
said
What the
to
setup
have
was?
flown a kite.
There's no way that he just stood out there going, well, I hope it gets hit by lightning. I'm sure he didn't talk like that either, man.
I mean, every source is saying.
Well, that he flew a kite.
Yeah.
But surely
Franklin's kite was not struck by lightning.
Right.
Okay.
That I
Well,
know.
then he would have been, yeah.
Electrical fields were moving nearby, and that created
The kite picked up the ambient electrical charge.
Yeah.
Yeah.
That's pretty damn cool, though. He was a smart son of a bitch.
Hell yeah. Good stuff.
Got to give him credit for that.
Good stuff.
And apparently he got the most quality poon in France that there was available at the time. So got to give him some props on that as well. And don't forget to check out Dr. Scott's website at simplyherbals.net. Simplyherbals.net. And I will say this, Dr. Scott, and this is not an advertisement because we can't really advertise, but your CBD nasal spray is the bomb. That is the best thing you've ever done.
Thank you.
It's in the right delivery system. Finally, I know you must have said something to whoever made it.
Mm-hmm.
That my old pal, Dr. Steve, wasn't as thrilled with the old delivery system. This one's perfect.
Thank you.
So I'm just wondering if anybody's reached out. Have you sent? Because you always send some stupid tchotchke or something when you send something out to one of our listeners.
I do always.
So have you sent out anything lately?
Oh yeah, we sent a
to
few
our people.
Actually, we sent. I think we had 3 Weird Medicine
3
orders this week, which is good. That's
cool.
good, though. No, that's good. I'll take it. Hey, listen, 3.
Oh,
it's a hell of a lot better than 0.
Well, true.
And most of them order more than one thing too.
Okay.
They'll pick up a couple of the sprays or a fatigue.
Well, anyway, yes, it's not an ad.
No,
but,
no, not an.
But still, I have to say that. But yeah, check out Dr. Scott's website. It's simplyherbals.net. You hit a home run with this one, my friend. I'm just going to tell you that right now.
Yeah.
And I get nothing from that. No. We get nothing from that. So.
And you'll like it.
Yeah, that's right. And I'll just keep bending over and taking it up the rear end, and I'll like it.
Thank you, sir. May I have another?
So yeah, very good. We have a couple of topics, and then we got a million questions. So this is gonna be very question heavy.
Jump in.
We'll do it. So here we go.
It's Tacie's time of topics. A time for Tacie to discuss topics of the day. Not to be confused with Topic Time with Harrison Young, which is copyrighted by Harrison Young and Area 58 Public Access. And now, here's Tacie.
Hello, everyone.
Hello, Tacie.
I know the show just started, but if you forgot to go pee, now would be a good time.
Oh, really? Why?
Oh, yes. Well, because I have 3... it was another slow health week, if you will.
Okay. Well, that's okay.
What does that mean?
It would be just as funny if I played that and you just said, I don't really have anything.
Well, I'm sure that's going to come at some point. And maybe next week. So the first little story I have is about how an IUD ends up in a woman's bladder.
Oh.
The symptom was blood in her urine.
Okay.
She had gotten it a decade earlier, and it had eroded through her uterus into the bladder.
Holy moly.
IUDs can last up to 12 years, which I had no idea. The perforation...
Well, you forget about it.
Happens. How could you? I
can tell you some stories about it. We're going to, as a matter of fact, talk later about a story about someone who forgot something like that.
Well, the perforation happens...
And it wasn't anywhere close to 10 years.
Is this Tacie topic time, or is this Steve?
Right. Well, this is Steve's show. So Steve comments.
Teasers.
Steve comments on Tacie's topics.
Perforation happens in 1 in 1,000 women. And they found a bladder stone, pulverized it, and removed the device. So that is my first little story.
Wow, that was a good one. So if you have not had your IUD checked in a while, you should have it checked. And the thing that is disturbing about that is this patient probably should have been getting pap smears.
That's right.
And go at least... at the interval that they recommend.
Okay.
And some people are every 3 years now, but still, if that thing was going on for that long, I'll bet you that she was not having routine medical care.
No, I agree. So the second boring story that I have is a man had a 4-inch piece of cement in his heart after a spinal procedure. He was 56. Chest pain, difficulty breathing. He went to the ER. This was in the New England Journal of Medicine.
Okay.
The spinal procedure was done to treat a vertebral compression fracture. It's called kyphoplasty.
Kyphoplasty, yes. So this is what happens if you think of your spinal column as a bunch of blocks of balsa wood, and they're on top of each other with some sort of gel between each one, and so it makes it flexible. And if you have compression in the axial direction, in other words, pushing down on the spine, the spinal column, you can actually crunch one of those vertebrae. Usually it's because you could have a tumor there, or you could just have osteoporosis, or you could have some terrible trauma. And when it does that, the pieces move around and it causes horrible pain. And one of the treatments they can do is to actually stick a needle in there and put
like a concrete
epoxy.
Yeah, like concrete.
Yeah, it's like concrete, but it's epoxy resin, and they put it in, and under pressure and it has to be under pressure because there's a lot of resistance in there. It will lift back up and reform the vertebral body in theory.
Yes. Not
And
perfectly,
so
but
that's
it's-
what a
yeah.
kyphoplasty is. And then, after that's done for a lot of people, they have complete resolution of their pain. They get full function again. Apparently not in this case. It sounds like somebody might have pushed the needle in a little bit too far.
Yeah, it says a rare side effect is that the cement can leak from the bone into other areas, causing a blockage or embolism of a blood vessel.
Yeah. Oh,
So,
I see. So
Doctors removed the cement and repaired the tear in his heart.
holy moly. Does it say what part of the heart it was in? Because if it was in the right side of the heart, then that would have been a vein that that they injected cement into a vein and then it traveled into the heart. Did it say? It's okay if you don't know.
So, yeah, I do not know because I wrote this down.
Oh, you did?
Yeah, so I do know. I
She
do
actually
know.
knows
several
I tell you what,
she abstracts this
Dude,
shit and
listen.
actually does.
Listen,
hell.
since she's retired.
bill.
Yes.
If it got injected into an artery, it would have been traveling away from the heart, right?
Correct.
So it would have to be a vein.
It's got to be a vein,
Yeah.
or they injected it directly into the
Into it,
heart.
yeah.
That was
Or
what I
in-
was thinking.
yeah.
Because if it was
it's right-
T7, T8,
your heart
straight through.
Your heart
Yeah.
is right there.
They shouldn't make the needle that long.
And they have the needle, and the guy's going, oh, and they go, and it's like, oh, okay, maybe I should back that up a little bit.
Yeah, it's kind of, maybe about the time the neurosurgeon was putting in there had a sneeze or achoo.
Yeah. Yeah. And then the scrub tech said,
Well, that's because you're an idiot.
But that stuff is kind of like
Sure
you were
they
saying.
didn't say
No, I don't. But don't you? That stuff is kind of hard to control as far as where it goes, and
yeah,
to a certain degree,
you
yeah.
are doing things without being able to directly visualize it. One of the things that they taught us when I was a medical student, I remember having to do a rigid sigmoidoscopy on a homeless person that had rectal bleeding and they were unconscious. We couldn't get consent. I mean, it was bad, but it was an emergency. So we had to do, and of course, in an emergency, get the fourth-year medical student to do it. But we did a rigid sigmoidoscopy, which we don't really do anymore. It's a metal tube just to look and see if you can see where the bleeding is coming from. And they always said, don't ever advance this thing except under direct visualization. In other words, you got to be looking through it and then advance it, because if you just shove it in, you could perforate somebody's bowel. You could even still do it if you do it under direct visualization, but at least it reduces. But in a situation like this, there's no direct visualization. Now, you might be able to use X-rays to watch what you're doing at the time, but even then, you're seeing a 2D projection of a 3D image, so it's very difficult. And did they say what the incidence of this is? By any chance? No. It's okay.
I mean, it probably did in the article.
Okay,
It
fair enough.
just says rare
Yeah.
side effect.
Okay, rare. We'll take that as 1 in a jillion, I hope.
Yeah,
so
she
it's a procedure I may need someday.
Yeah.
So the last little story that I have is that a woman's pet cat gave her cowpox.
What?
Doctors feared she would lose her vision. She took a bunch of antibiotics, but it didn't work. They were trying to figure out what it was. This was also in the New England Journal of Medicine.
Yeah, good.
The patient's pet cat had developed unusual lesions on its paws and head, so I guess they put the two together. The cowpox can affect cows, cats, and humans. It's very rare to get it from a cat. The woman received treatment with tecovirimat that doctors got from the U.S.
Give yourself a bill.
Damn it! Come on, man.
Suck it.
I'm too down already.
That doctors got from the U.S. Strategic National Stockpile, kept in case of a bioterror attack with smallpox.
Yeah, and that's something.
Jeez
It
Louise.
cleared her infection.
It is a cousin of smallpox.
Wow.
That's what Salk noticed. Was it Salk? Jesus, it was Salk, right? He noticed that milkmaids were not getting smallpox. They'd be in the same house as everybody else. So a lot of people, they all live together in these houses, and you would have your servants or whatever living in there, and the smallpox had swept through the house, but the women who were working with the cows weren't getting it.
Wow.
And then he put 2 and 2 together. They had gotten cowpox. So one of the things he did was started inoculating people with cowpox just to see if it would protect them. And in fact, it did. It was the first vaccine. And because cowpox doesn't kill you like smallpox does, but it is closely related to it. Isn't that crazy?
That is crazy.
So, anyway,
I didn't know you could still get it. Had this woman been vaccinated for smallpox? Surely not.
It didn't say that, and it did not say how the cat got it.
Okay, she hadn't been. She was 28. They don't vaccinate for smallpox anymore because it's gone.
How in the world did that cat get it?
Well, apparently it's not that uncommon in cats.
Wow.
It's uncommon for humans to get it.
Wow.
Yeah, samples from the cat's lesions and the woman eye both tested positive for orthopox virus. Isn't that something?
I thought it was cool that they got it from the Strategic National Stockpile.
Hell yeah.
That's pretty cool.
Good
Yeah.
to know we have one.
Monkeypox is also related to orthopox viruses, too. Yeah, well, we have to because, the thing is, when we eradicated, and when I say we, the human species, eradicated smallpox, they kept some of it in vials in different places around the world. Now, you would say, why would you do that? Well, you kind of hate to render something extinct, and then it kind of goes against some scientific thinking that you just destroy it so we never have access to it again. Now, I think at this point, now that we can sequence DNA, you just sequence its DNA, you keep that in a database somewhere, and just kill the fucking viruses that we have in these stockpiles.
And you can always make it again.
You can just make it if you need it for research purposes or whatever.
Yeah.
But, the last thing we need now that we don't vaccinate for smallpox anymore is someone just releasing smallpox back in. We have to do this all over again, So it's fucking viruses.
So that's it with Tacie's.
That was awesome. I'm going to give you
Give
another
yourself a bill.
That's 2, Scott. Why don't you just...
That was 3.
I got 3?
Tacie's time
I
of
didn't even
topics.
notice one.
A time for Tacie
Suck
to
it.
discuss
I'm
topics.
getting
All
crushed
right,
here. Getting crushed.
All right, now, do we have Lydia's time of topics? Hang on.
It's Tacie's time of
Damn it.
topics.
Wait, let me try that again. Wait a minute.
It's
Lydia's
time of topics.
Anyway, what do you got?
So in sticking with our IUD theme, we also have another woman's topic.
Excellent.
For the ladies in the room.
All
Excellent.
4 of them that listen.
For all 4 ladies who listen, and it's certainly something that I have learned today. I was today years old, right? I don't ever say this word really, except for talking with my 2-year-old, but period poops. Poops being the
You say
operative
period
word.
poops to your 2-year-old?
I say poops.
Oh, okay, the poop part. Okay.
Not period poops.
Now, mommy's having a period poop.
So, Tacie, if you think back, so there's a tendency for women to have more bowel movements, more frequent bowel movements, or even report diarrhea whilst menstruating.
That is true.
It is true,
Really?
right?
Yes.
It is true.
Did you just tell Tacie, did you say if you remember back, how do you know she doesn't have periods anymore? Are you accusing her of being
No,
postmenopausal?
I just meant
Menopausal?
like through your history of having your last.
Listen, I'm taking this wonderful birth control, and I do not have them, and thank God, praise God. So
I've tried that. It does not work for me.
Really?
Yeah.
this is one for old people.
Oh,
It wouldn't be for you.
maybe in 5 years. So, yeah. So there's science behind it. That reason, go
Okay.
figure. Okay, so two chemicals. One of them is a hormone that we all know called progesterone.
Yes.
Which helps to maintain a healthy pregnancy.
It's delightful.
It also is slightly constipating, and so when you're on active menstruation, the level of progesterone decreases.
Yes.
So therefore, you kind of stop that constipating approach. And the second is more active, and that's the release of prostaglandins from the uterus. So prostaglandins are fatty acids that, from the uterine perspective, help us to contract our uterus during delivery.
Sexy
They
stuff.
they can give you, IV prostaglandins, to help with contraction. It also causes, the period cramps. the shedding of the uterus. But it can also, prostaglandins also have a role in bowel contractility and bowel contractions. So
Can you please stop bullshitting?
is it?
No, you're
Does it sound like bullshit?
He's just totally.
Can you please stop bullshitting and
He's
get to the
playing with
question?
buttons.
I'm just pushing buttons.
Anyway, so you increase your contractions via the prostaglandins,
Yes.
of your colon. So
Okay.
more
That's
frequent
awesome.
period poops, guys.
That's a good one.
Give yourself a bill.
Just give yourself one.
Please go ahead.
No.
Well, I was
you
going to say,
don't.
so is that why constipation is more common prior to? Right?
That's
It
true.
could be.
That's
You
also
get the
true,
progesterone
Scott.
surge.
Yeah, I would think so. Yeah. Because that's certainly something we see
Yeah,
a
so
lot.
that's one of the signals is when you have a pregnancy brewing in your uterus is one of the signals that the placenta, the nascent placenta will put out is a progesterone analog. And that, so one of the ways that the body knows there's no pregnancy in there is when the progesterone level falls. So, and then it's like, oh, man, I guess we got to slough this lining off and try all over again.
Try again next month.
Isn't that wild?
Yep.
Yeah. So anyway,
Interesting. Speaking of women who listen, there are two women who listen. They are Jen and Carol from the podcast Mom Swipes Left. And they have submitted some questions to us.
Okay.
And what I hope they will do in the future is because we have, when you guys do women's health stuff, the guys are actually some, may be interested in it, but we do get a lot of emails saying, thank God you guys finally did something for us. And when we first started, the show was primarily just dudes because Opie and Anthony's audience was mostly dudes.
Penises.
Yeah, penises, nuts, dick cheese, stuff between your toes. Women don't ever have stuff between their toes because they clean themselves off. I mean, they're hygienic. But anyway, apparently we do have more women listening now. So these are questions from Jen and Carol, and I'd like to maybe we'll do a little bit with them where they record a question and ask. But anyway, the first question is, do all animals masturbate? So not really a women's health question, but that's okay. It's they're cool women, so they're asking a cool question. And I had to go to my AI model. So I'm working with an AI model, and it's called GPT-3, not to be confused with Chat GPT. And this is one that I've tweaked a little bit to answer medical questions and help me in my job. And so I asked it, serious question, because if you don't preface it with that, it will say, this is inappropriate.
Oh, really?
Oh, yeah. I said, what animals other than humans are known to masturbate? It said, studies have shown that a variety of animals, including primates, dolphins, and elephants, are known to engage in self-stimulation or masturbation. Then I said, can you elaborate? This is for my radio show, just because I'm big timing the AI, right? And so yes, sure. Primates such as chimpanzees, bonobos, and gorillas have been observed touching their own genitals for pleasure. Dolphins have been observed using their fins to rub against their own bodies and the bodies of other dolphins. Elephants have been seen using their trunks to rub their genital. What? Can you imagine being able to beat yourself off with your nose? How awesome would that be? Why aren't they doing that all the time? What's wrong with them? Additionally, cats, dogs, and it's probably sand because they got sand all everywhere. Additionally, cats, dogs, and other mammals have been observed engaging in self-stimulation. So that was a good answer from GPT-3. And I used to have a dog that if I threw my coat on the floor, he would just start humping it.
Oh, goodness.
Cosmo would do that with his little stuffed kitty cat. Do you remember that?
Oh, yeah. He would just bone it all day and all night.
For some reason, this brings up the time that we were at
Don't bring up that time when I did that. What you're going to talk about?
in Tampa, and we watched the monkeys eat their poop.
That was the greatest
for an
thing.
hour, and the boys thought that was just.
So there was a group of chimpanzees, and they were just standing around, and this one puts his hand behind his ass and shits in his hand, right?
No.
And he's looking at it, and the other ones are poking at it and like, what do you got there? What do you got? What do you got? And he's like, look what I did. And they're poking at it. And then didn't one of them like stick their finger in their mouth after they poked on it?
Yeah, they were
and
eating
stuff?
it.
Yeah, they
And
ate
the
it.
boys,
was like,
I
"Here,
mean, they were like, how old
I
were
made
they?
appetizers.
How
Have
funny.
some.
They were teeny.
Oh my gosh.
They still remember that. It's burned in their
It's
brain.
traumatic. Yeah.
Traumatic in a good way.
In a good way. Oh my goodness.
That is pretty good.
Well, I did.
Well, what else have they got to do?
Yeah.
There's nothing else to do there, you know?
Well, I don't have a lot to do, but that's not something that I.
I'd find a tree to swing from or
shit,
something.
and
Yeah.
Yeah, but you've swung on all the trees. You've known that. You've been there. You're in a zoo.
Take a nap, baby.
You
Bang
finally
the
have
girl.
something that you've never seen before in that place is this fresh turd. I remember when I was, before I was potty trained, I remember this like it was yesterday, and I was still in my crib, and we were still living in a house that I know we had to. I was really little, so I didn't like do this when I was 6. If I was 15 months maybe,
Okay.
and I remember kind of pulling myself up in my crib and shitting in my crib, and I thought it was very creative. It was like, wow, look at that. And I know that I didn't have words then, but I remember thinking that lady that takes care of me, mom, is going to be really happy with me. And I was very surprised when she came in and she was like, what the hell is this? And, said bad baby or whatever it was that she said to me. I was very disappointed.
Wow.
That's my earliest memory. And it couldn't have been maybe 15, 16 months of age. Anyway.
Starting to see some
That did
trends,
remind
Tace.
me, not to go off on too much of a tangent, but there's the coffee that's produced from poop of animals.
Yes.
Yeah. Okay. Tell me
Yeah.
about that. I've heard
So,
about this.
Yeah, the coffee is called civet coffee or Kopi Luwak. And
Kopi
so,
Luwak.
Luwak.
Don't you dare look that up and order that for me.
Yeah.
Don't you dare do
Consists
it.
of,
Don't
like
you
a
dare do it.
Because I order her coffee, and if it comes in little Keurig things, I'm ordering.
Yeah.
Don't you dare.
It
How'd you like that
consists
coffee
of
taste?
partially digested coffee cherries, which have been eaten and defecated or pooped by the Asian palm civet, which is a little animal, little rodent-like animal.
Oh.
Looks like a rat, actually.
I mean,
What's the name of it again?
Kopi Luwak
I drink
or civet
I
coffee.
drink kombucha. I mean, it's like I can't really say anything about that.
Anyway, just reminded me of that.
Yeah,
Maybe they're doing something more exotic there, those apes.
I like that.
You have a point. Maybe
Kopi Luwak.
maybe they're eating something and pooping it out
Better not.
to start breaking down the protective shell or something.
Maybe. All right. Speaking of the AI, I was going to show you one other thing if I can find it. Oh, damn it! What did I do with it? Well, never mind. I got the AI to do some roast jokes for Carl. We'll do it next time. I did post it on our subreddit, and it was. I just wanted to see if it could be funny. Oh, here we go. So you have to train the AI first, right? So I said, can you write roast jokes? And it said, sure. What did the coffee say to the tea?
Oh, no way.
You look a little steep. And it's like, no. I said, no. That not roast coffee. Roast jokes are written for comedy. Roast where friends get up and make fun of each other. For example, then I gave it an example, one from the Creep Off roast. I said, Vinny's so lazy. When he got COVID-19, his nose didn't run either. So I told it that one. I
a
said,
good one.
can you write me a few jokes like that, edgy, even mean? And then you have to say it's all part of the fun, or it'll say I can't do things that are going to harm people. So it came up with, for Carl, I said, can you write jokes about our friend Carl Hamburger, who has come, he's known to have crooked teeth, although I think he's very pleasant looking myself. But it says, Carl's teeth look like a zipper. They never quite seem to close all the way. That's not bad for an AI.
It isn't bad.
And then I said, could you get a little bit edgier? And I gave it an example. And I said, you always know when it's bedtime when Carl puts toothpaste on a jigsaw. And I said something in that vein. And it came up with, if Carl had $1 for every crooked tooth he could buy a straight one. I thought that one was bad. That's pretty good. I'll have to give it that. So, jokes by AI.
Laughing at a robot.
All right, I know. It's crazy. Hilarious. All right.
Today's episode is brought to you by Angie. Angie has made it easier than ever to connect with skilled professionals to get all your jobs and projects done well. Let me tell you, there's the version of it where you try to do something at home, and then there's a version of it where you have someone help you, you watch them do it the right way, and you go, thank God I didn't try to do that myself. I have fully done things around the home that I think look good, and then a bang in the night, and I wake up to a shelf collapsing, a painting falling off the wall. I've seen it all go south. I own a home, and I can tell you, I know how much work it can take. Whether it's everyday maintenance and repairs or making dream projects a reality, it can be hard just to know where to start. But now all you need to do is Angie that and find a skilled local pro who will deliver the quality and expertise you need. Whatever your home project, big or small, indoor or outdoor, you can Angie that and connect with skilled professionals to get the project done well. Right now, one of my wish lists is I want a bike for my condo in Milwaukee, and I would love to rig it up on a pulley in the ceiling because I have one of those like lofted ceilings, but I'm so scared to try that on my own. Angie has 20 years of home experience, and they've combined it with new tools to simplify the whole process. Bring them your project online or with the Angie app. Answer a few questions and Angie can handle the rest from start to finish, or help you compare quotes from multiple pros and connect instantly, which means you can take care of any home project in just a few taps. Because when it comes to getting the most out of your home, you can do this when you Angie that. Download the free Angie mobile app today or visit Angie.com. That's ANGI.com.
With Walmart's new fresh and frozen subscriptions, you can save time on your weekly grocery shopping.
Dad, you're supposed to be grocery shopping.
And miss the chance to embarrass you in front of your friends? I subscribe to snacks and wet napkins. You know how messy you are.
Dad!
Walmart. Subscribe to your weekly list.
Discover My Self Le Parfum by YSL Beauty. The new, sensual, and warm intensity enhanced by spicy vanilla bourbon. A fragrance for a man born unapologetically himself. Myself, Yves Saint Laurent.
This podcast is supported by Progressive, a leader in RV insurance. RVs are for sharing adventures with family, friends, and even your pets. So if you bring your cats and dogs along for the ride, you'll want Progressive RV insurance. They protect your cats and dogs like family by offering up to $1,000 in optional coverage for vet bills in case of an RV accident, making it a great companion for the responsible pet owner who loves to travel. See Progressive's other benefits and more when you quote RV insurance at Progressive.com today. Progressive Casualty Insurance Company and Affiliates. Pet injury is an additional coverage and subject to policy terms.
Hi, I'm Lara. After 20 years of making Larabar, I still believe that simple and real can be indulgent and delicious, which is why we're introducing Trail Mix Bars, our newest Larabar made with 51% regenerative almonds. Learn more at larabar.com.
Number one thing, don't take advice from some asshole on the radio.
All right, here we go. Let's take some questions. Let's quit messing.
Hello, Dr. Steve.
Hello.
How are you?
Oh, good. Very good. Thank you.
Good to hear. Hello, Dr. Scott. How are you?
Good as well.
Good. Good to hear. Dr. Steve, I have a question for you.
Oh, he didn't ask you two if you're okay.
No, Tacie.
No,
That's
fine. Who whispered Cardiff Electric? Because I want to know who did that. Very good. Very
I'm
good.
learning.
Yep,
Give yourself a bill!
That's exactly who that
God's
is.
sakes.
Hey, you roll your eyes, buddy. But I'm a
But this
noob.
is a great question, though. And this is from
As you may know,
this is like back in April. So
I occasionally dabble in the use of edible cannabis products.
I did not know that.
Also, as you may know, I have a very luscious masculine beard.
Okay.
Occasionally, while grooming, I will shave my beard. At this time, sometimes I can get the faint smell of marijuana
There you go.
from the beard.
How'd that happen?
As I said, I only consume inedible forms like gummies or chocolate.
Can you please stop bullshitting?
That's more appropriate.
So why does my beard smell like marijuana?
Okay. Jesus, dude. So I looked this up. It made sense to me. Marijuana is fat soluble. And so it is stored in fat cells, and the skin has lots of fat cells in it, and also secretes oil. And I looked up a 2017 article showed that cannabis can indeed, if it's taken orally, be secreted in oil and sebum glands of the skin. And if you've got a big, you want to smell Scott's hair? Smell Scott's hair.
Smell my beard.
See if you can smell any marijuana on him because he only uses edibles.
I only use edibles.
But if you have a big old beard, if you have a big long beard, it's got much longer time to have more cannabis like molecules secreted onto those hairs as they grow, and it's right under your nose. And when you cut it, you may actually get a whiff of pot because the nose is extremely sensitive, and that is a very distinctive smell. I mean, when you smell it, you know what you're smelling.
Even the first time you smell it, you're like,
Yeah,
that's
pot.
what marijuana smells like.
Yeah. All right.
So is that why they'll do? Because there's an alternative to the drug testing.
A follicle testing.
Yeah.
We've pulled that. We did this on a guy. He would always say, "Well, let me say I heard about this." This guy that would always say, "Well, I can't pee," and so they'd say, "Well, okay, we'll schedule you to come in for a follicle test." And we'll get a hair follicle. And so the next time he came in, he'd shaved his head, right? And he was like, ha, ha, ha. And then the investigator just reached over and plucked a hair out of his arm and went, okay, no problem, and stuck it in there. So, all right. Anyway, so yes, that is a distinct possibility. Thank you, Mr. Cardiff, for your phone call. Let's see here.
Hey, Dr. Steve. This is John from Chicago.
Hey, John.
Question about tinnitus, or tinnitus, whatever.
Yeah. Nobody knows how to
I
pronounce
get
it.
tinnitus every now and then. That's just really the kind of the random ringing in the ears, right? But it can be worse for some and others, right? For me, it seems to come on and off every now and then. It's random. It's just something, I'll move my head and then just I have that like long piercing ringing in the ears. That's tinnitus, right? So I guess if you could answer that question, I'd appreciate that.
Yeah, absolutely.
Speaking of tinnitus, what is there a worrisome aspect of the ringing, or is it just an annoyance to the person who's experiencing it?
Right.
Like, is it a sign of degrading, ear functionality or something like that? I know you're, I think, a fan of that Children of the Men movie, and there's that scene where Julianne Moore says every time that ringing happens, there's like one, type of tone or decibel that you'll no longer hear it. I was like, is that?
No,
did a little Googling, that sounded like bullshit, but I don't know. Does it mean anything when that ringing happens? Is it kind of like, hey, you'll never hear that specific tone again? Anyway,
right.
Appreciate it. Love the show. See you later.
Yeah, that's not true. And they, if you remember, that character said a lot of stupid shit in that movie. So, but it's a great movie, by the way. Children of Men, highly recommended. Benign paroxysmal vertigo can cause tinnitus, but he didn't say he gets dizzy. Mm-hmm. But there are people who have positional tinnitus or tinnitus. We were always taught it was tinnitus. And if there was an I at the end, it would be tinnitus, except that we also have pruritus is spelled with the U.S., so there's no rhyme or reason to it. So it's fine either way. But tinnitus is just a ringing or sound. It could be static. It could be even music, because sometimes the brain will interpret this static or random sounds as music. And people say, I'm hearing old swing music or something, because that's in their head. And it never stops. It can drive you bonkers. So you want to see an ear, nose, and throat provider for that. And the reason I say that is this could be just crystals in your inner ear that are moving around when you move your head, causing some ringing in your ears. But there also is a condition where you get a thing called dehiscence of one of the semicircular canals, and it can cause a positional tinnitus as well. And what that means is it's just breaking apart. And you would need to go to like a microsurgery center to get that fixed. Not saying that's what it is. That would be unbelievably rare. Mm-hmm. But I'm just saying this isn't something. Don't just blow it off and go, well, Weird Medicine said it's probably just benign. I just want you to get it checked.
Yeah.
So go see an ear, nose, and throat. Show them the position that you have to assume to create the tinnitus. They'll do a hearing test. They'll try to reproduce it in there. They may do some imaging just to make sure that you're okay. And if it's just sludge in your inner ear that's causing it, then okay. Then they'll give you some exercises, one called the Epley maneuver, just to get that sludge in a place where it doesn't cause problems.
Did he say what position he was in?
I don't think he did.
That's kind of interesting, though, isn't it?
Yeah, it is interesting.
So you also think about like a loud noise exposure, right? Like veterans who have been exposed to loud noises.
But it's there all
often
the
report it
time.
more. Yes, it'd be there all the time.
Well,
yeah.
But
it wouldn't be positional.
Yeah,
so I guess what I'm
yeah.
saying.
Because I was going to say, and that's why I was asking. A lot of times a lot of people will have the tinnitus with position, but it's at bedtime because there's no sound, so it seems relatively louder.
It seems like it's when they're lying down, but it's actually So you got to ask those context questions too.
Yeah, and plus it could have been medication and caused.
Platinum.
Could be medications, antibiotics. Could be loud noises.
Now, when you just use some jargon, when certain chemotherapy agents,
certain
what you're saying.
chemos, yeah.
Okay.
Damaged nerves.
Yep. Alrighty, very good question.
Good one.
Hey, Dr. Steve. I was wondering, I know I had heard a episode earlier that you said that you answered this on your first show, which I can't find anywhere.
That's okay.
But
join the Patreon.
What makes it so that when you ejaculate, the ejaculation comes out very slow and dark colored? It almost like it doesn't want to come out.
Yeah. That's a great question. Very common.
If you could answer that for me, I'd be appreciated.
Absolutely, man. And yes, that is a question that's come up very often. I think it was on our very first Sirius XM show that this came up. And a lot of times when you have yellowish, thick semen that has like chunks of looks like tapioca pearls in it, what that is seminogelin. There's a protein in semen that causes semen to gel. But you don't want it to gel in the seminal vesicles. You want it to gel afterward. So it's like what's supposed to happen is it's almost like one of those epoxy cements where you mix two things together and then you let it sit and then it turns into epoxy, right? Or that's what we know. And so there are components of this protein that aren't supposed to activate it until it actually hits the air. And so and the purpose of it is when you ejaculate, we often forget that the reason, we forget the point of, thank you, go fuck yourself. But we forget the point of intercourse.
Whose point?
Is to impregnate, for the man to actually impregnate a human female. That was what it was designed for, right? And
allegedly,
we forget that. We just have intercourse with whatever orifice and whoever, but we kind of that aspect of it slips our mind a lot. And so the reason for semen to gel is because when you ejaculate into a vagina, you don't want the woman to stand up and run away like they probably did in the caveman days, because there's a saber-toothed tiger coming, or God knows what kind of consent they had back then. But you don't want the semen to just flow back out of the vagina. You want it to gel and stay there so that the sperm cells that are inside it can work their way up and try to find an egg in the right place, right? And so that's what that protein seminogelin is for. And but if you leave this fluid inside the seminal vesicles long enough, it will gel there. And then when you ejaculate, you'll ejaculate sort of this jelly-like semen that's, nobody's looking at it really. So unless you're Are they?
You wouldn't want to have it chunky, right? Like
Chunk
the
style.
partner,
You don't like
the
chunk
partner
style?
might
I'm gonna-
not appreciate
She's a
it.
smooth and creamy kind of gal, not a chunky kind of gal.
So, okay, so you would see it when you're giving someone oral treats, I guess, and you're not swallowing, right? I mean, that's when else would you see
Or
it?
you would like sense it if you were
Yeah,
swallowing it.
I guess.
Yeah.
Yeah, I don't know how tactile it is. I mean, it's thicker. That's true. It wouldn't be like.
Then is the treatment for that or to overcome that ejaculate more?
Yes.
Yeah.
Yes.
Okay.
Yes.
How about dehydration? Cha cha cha.
Yes. That too. There you go.
Give yourself a bill.
So fluids. You're the only one that's counting, dude.
Oh, good for
Yes,
you.
I know. That's okay though.
Good for you, buddy.
Fluids.
That doesn't seem very sincere.
And frequent ejaculation.
Okay.
All right. Which is why mine is like concrete, but that's a whole other story. And the next
Shut up.
Hey, Dr. Steve, Dr. Scott, Tacie.
Hey.
Hello.
How you guys doing?
Good. How are you?
Good. Doing well, too. Calling with an update from a call I made a few weeks ago about my fitness tracker when I was sleeping, registering this huge spike in heart rate within the first hour or two of sleep. So first of all, I want to give you a bell. If I'm, as the non-host, I'm authorized to do that.
Yeah.
For throwing
I don't authorize it.
Unauthorized.
I think you kind of came
Wait a
up
minute.
with
Okay.
I didn't like that
throwing cold
question.
water on an hour or two of sleep. So first of all, I want to give you a bell. If I'm, as the non-host, I'm authorized to do that.
You certainly
for
are.
throwing cold water on my hypothesis that this could be the hypnic jerk. I think you kind of came up with a theory that it might be something called nocturnal arrhythmia. So before following up with my primary care, I did some more research online, and it turns out that this particular model of fitness tracker, won't say the name, but it rhymes with shit slit, is a common known bug that other people were reporting that like right around 1
really?
a.m. in the morning, which is
This was a glitch in the operating
Did
system.
he say shit?
Yeah.
He did.
It's a glitch in the operating system. Can you imagine how many other people were crapping themselves seeing that?
Yeah. And how many cardiac workups were performed?
Oh, yeah. Yeah.
Oh my goodness.
That is
Okay.
one of those things where in medicine, like if someone faints and they go to the emergency room, they may end up getting a tilt table test, an MRI, they get all this stuff. It's like, no, you just fainted.
Yeah.
You know? So it's this sort of cascade. So Lydia is exactly right. I would love to know how many people went to a cardiologist over this.
I'd say a bunch.
Because we were pretty convinced he had nocturnal arrhythmia.
Yep.
That spike was crazy. It's like 90, 90, 90, 90, 90, 150, and then right back down to 90 again. It lasted, 5-10 minutes, something like that. Okay.
Wow.
Let's see what he said.
shit slit. It's a common known bug that other people were reporting that like right around 1 a.m. in the morning, which is when the time that I was experiencing this, it would, measure this huge spike in heart rate that no one else could explain. Wow. And other people suggested that it was doing this even when you weren't wearing the shit slit, the fitness tracker. So I took it off, left it on the nightstand, and sure enough, night after night, it
We're not mentioning any brands or anything, so I'm glad he's masking it so perfectly.
Very smart of him.
Yes.
165, 170 heart rate without even being on my wrist. So unless there's a ghost living with me that's putting it on at night, I think it was bullshit. So that's my update, but it kind of has me thinking of like, what's the benefit of even wearing?
I must check my heart rate with this shit flick device. Anyway,
this thing if it's not producing reliable or accurate data. I mean, I love it for measuring my steps and the distance that I go, but beyond that, is it worth, if it's putting out this stuff that is inaccurate, is it worth wearing? I mean,
that's software, easy to fix. Mm-hmm. I think these things actually are. I like the fact that people are paying attention to their sleep cycles,
Yes.
and it's good for me because it tells me you're not getting enough sleep, and I always ignore it. But if I ever did start to pay attention to it and do something about it, it would be very useful. And I think it's okay. The algorithms they use for things like blood oxygen are not to be relied on, but they'll get you in the ballpark. And they will tell you this is not a medical device. But it can give you a signal that says maybe you should do further testing or whatever. So I still think they're worth having.
Sleep score it gives me seems kind of arbitrary.
And also, if you've ever been on these things, when you start doing exercise, you get these little badges and stuff. People like, ooh, I'm only 100 points away from my Explorer badge. It's like, what does that do for you? Nothing, but you have it.
There's something.
Humans kind of like that sort of thing.
Yeah.
Google sucks me in every time. Well, you're only 100 points away from your next level as a local guide. And I start looking for pictures. Did I take a picture at Perkins? Can I get that up there and get an
Mine
extra 100
says
points?
you're only 9,600 steps away from reaching 10,000 steps a day. You can still do it.
11.
Yeah, it's only 7 p.m. You can do it.
Right. That's hilarious.
Now I'm kind of rambling, but I guess my new question is, other than motivating people to get more active, move, if it's tracking their steps, do you guys see that this is a net positive, or is it just more data that's possibly unreliable that is interesting, but people don't really know what to do with?
I wonder what they're doing with the aggregate data with this. Is there research that can be gleaned from that?
Sure.
Is there the average heart rate of the normal American going up or down over time?
Activity
That
level.
kind of stuff. Yeah.
I was just reading about Healthy China 2030. I did
Really?
a paper
What's
on
that?
cardiovascular disease in China.
Oh, yeah.
And for the prior, I can't remember if it was the prior 19 years. Anyway, the past couple of decades, the rate of cardiovascular disease is just really going up exponentially as their economy improves and have.
You think it's diet or lack of exercise?
Both.
Air quality.
Largely diet driven.
Air quality,
So uncontrolled hypertension, elevated cholesterol with the diet changes.
Really?
So they have this new Healthy China 2030 initiative. But it makes me think about that, right? Certainly a country like China would be able to track.
Yes. And the other thing is that one thing that they can do is, they've got that social score that if you have a social score, like you've said something naughty on the internet, you may get dings to your social score, and then you don't get preferred seats on train things. You can get banned from this and that. This is what I hear. It's I read this in the newspaper. Who knows?
Mm-hmm.
It's hard to. I don't know anybody from there, but I wonder if maintaining your ideal body weight and those kinds of things could become a governmental mandate.
Well, they're starting a huge national push on it. So.
It's a different way of doing things, isn't it? But it's pretty damn effective. All right, here we go.
Hi, Dr. Steve. It's Peppermint Patty.
Hey, Patty.
Hey, Patty.
Wow. Pardon my voice. I've got a cold. Hi, Dr. Scott. Hi, Tacie.
Hey, honey.
I have a question. On a Patreon show, you had said doctors just you can say to a doctor if you have some object stuck in your rectum that you sat on it.
Right. So, yes. So, patreon.com/weirdmedicine. We had a show where we talked about the fiction that we all have agreed between it's a contract between our patients and the physicians and other providers that treat them, that if you come in to the emergency room with something stuck up your rear end,
1,000,000 to 1.
It's crazy. I just sat on it, and everybody will believe it. Okay. Well, they won't. Nobody will believe it. They will pretend to believe it so you can save face.
Which made me wonder, well, then how do they get them out? Because what I thought of is a lot of lube and a chest opener. Sure, that is not how it's done.
It's not that wrong. And I've seen some that had to go to the operating room because it was too painful to remove, so you have to put somebody under general anesthesia. And if you remember years and years ago, Scott, I think you might have been here, where we played a video of physicians acting badly, and what it was they were taking a peanut butter jar out of somebody's, either their rectum or their vagina, I can't remember what it was, and they were all laughing and hooting and hollering, and somebody videotaped it, and then it ended up on the internet, and it's like, this is not cool. Cool. So we're supposed to have this compact. Now, that was not in the United States. In the United States, we're very respectful about these things, but one of the things that you have to do is first you just see if you can grab it with tongs and pull it out. And if you can't, it's too painful, you put the patient under, and then you get a speculum, and basically like a vaginal speculum. Have you ever seen a pap smear done? You put it in, it's got two sort of duck bills, and you can open it up so that you can dilate that opening, and you can visualize this thing. And then, yes, you may have to put a lot of lube in there and then coax it out with various different instruments. And if it's something like a light bulb, you absolutely don't want to break it. Yeah. So you have to be really careful. But there are, have you ever seen one of those things that you put screw light bulbs in with? It's got little sort of hands, fingers.
It's a little gripper thing.
Little grippers. Yeah. There are things like that. And so that you can go and just grab that very carefully and just coax it back out again. So, but don't do that. If you're going to stick something, I'm just going to say this. I'm not some namby-pamby, just say no type person. I have to say that frequently. But if you're going to put stuff up your rear end, put something that's designed to put up your rear end.
Yeah. Plenty of stuff.
Don't improvise.
Yeah, don't. Yeah. Just go to the store.
Yeah, go to a fun store and get some lube and do this with a consenting partner. And that way, if something happens, you've got somebody there to help you. But most of the rectal toys will have a lip or like a rocket fin sort of looking shape on it so that it can only go in so far and you can't lose your grip on it and lose it. Because, if you've ever put a suppository up your rear end, it's designed. Yes, it's designed with the pointy end and it's got a blunt end, and you stick it in there and it just loop right up there because there are muscles. The anal sphincter will tighten and then it will actually push that thing up farther into the rectum. That's what people don't understand.
That is a new feeling, I would imagine.
Yes. So don't do that. No. Go listen to the episode of the Creep Off podcast at creepoffpod.com that's called Concrete Enema, where I talk about a guy that, and we've talked about a little bit on this show, that gave himself an enema with concrete, which you should not do. Do not do that. It is an exothermic reaction. It cooked him from the inside, and it was a disaster.
Bad deal.
We talked about it at length on that show. Yep. So anyway. So, Dr. Scott, Lydia, and Tacie, before we go, I do want to talk about something we talked about, I think, last time, which was giant chicken breasts.
Yes.
And we were talking about that giant chicken breast we saw on Sam, the cooking guy, that literally looked like it came from a 20-pound turkey.
Great cooking show, by the way.
Yeah, Sam, the cooking guy, is the best cooking show on YouTube, I think. And he says the F word and stuff. He's hilarious. So we were talking about, we thought maybe it was hormones that caused this. It's actually not true. It says a 2015 survey by National Chicken Council revealed 77% of U.S. customers believe farms use steroids. And factory farm chickens grow faster and bigger than they did just 50 years ago. What consumers may not know is the poultry industry, motivated by product, almost exclusively raises chickens who grow so large they can't even walk.
Oh, wow.
So these broilers, those are chickens raised for meat, is one of constant agony. I remember we talked last time.
That's terrible.
You wake up and you're pecking out, you got your egg, and I'm going out into the world, I'm pecking my way out, and it's like, what the fuck is this place? I'm in hell. Yeah. I'm in hell. And it's just chicken hell, Anyway, but so I do buy. I buy a cage-free. No, that's the thing. That's the one time maybe that I would prefer smaller breasts.
I've got go ahead.
Oh, everybody does believe it's antibiotics.
Yep.
Right.
Well, antibiotics and steroids.
Steroids.
And hormones were banned.
Hormones. Yeah.
In like 1950, and it's really just Mendelian genetics.
Breeding.
It's breeding. It's just you take you got a bunch of chickens. Hey, this one's got bigger tits than the other one does. Let's breed them all together. And you keep breeding them and breeding them and breeding them until they have so much meat on them that they can't walk. They're just miserable.
I did know that because I went to the University of Georgia and we have a great poultry science program.
Oh, yeah.
Yeah.
Yeah. Really?
Wow.
Did you?
So I've got a friend that's like a chicken farmer guy.
Okay. Did you take the class or did you just hang out with your friend?
No, I was in that college, so the environmental science college. So my buddy was a poultry science major.
Wow.
So he would have to go out to all the chicken coops and feed them and wash it.
Now, I've been to some that were definitely not humane. I mean, it was just chickens wall to wall as far as you could see. And they're all pecking each other, and you walk in there and they're pecking you, and you smell the ammonia. It's just unbelievable. And you just got to imagine there's fungal and, just fungus and stuff just all over everywhere in there. But in their whatever it is, it's not really feces. It's, they have cloacas, so it's urine and feces together. But, it's just horrible. But then I know there are some places, I've never seen one, where they say, they're free-range chickens, they're cage-free, they run around. I don't know how you run a chicken farm that way.
Now, and cage-free can just mean they're not in individual cages. So they're still in those big buildings,
and those giant
wall
buildings.
to wall, but they're cage-free. So
Yeah, I see. So, but free-range means that
outside.
They're outside running around, acting the fool.
To my understanding.
Okay, I don't know how can you have a place big enough to do that and make as many chickens as we eat in this country?
Lots of
500 million
wire.
500 million chickens
They're not running very far if the breasts are
die to supply our Super Bowl requirement
Really?
for chicken wings. It's like 1 billion wings just on Super Bowl.
There was an interesting
These chickens running around without any arms.
psychology to that person that I think about often. Because I said, well, isn't it just so sad? Like you go in there and you have these, and he said, they're not animals, they're food.
They're just things. They're things we eat.
We breed them, they grow to maturity in X number of weeks.
Right.
They're not, and I think that was his coping mechanism because he's a really sweet person. But
yeah, you have to.
It stuck with me.
Well, and that's if you start thinking about it in terms of chicken holocaust, then it's nightmarish. But when you think about it as we eat meat, we have to eat, and we have to. I know people that think that they hear carrots screaming when you pull them out of the ground. I don't know what they eat.
It's Scott.
Mm-hmm. Probably me. It's me screaming.
He doesn't eat carrots.
I love carrots.
So, I don't know. I mean, that does, if the carrots are screaming when you pull them out of the ground, then it does raise ethical concerns about eating carrots. So you can just take this thing to all kinds of extremes. And so I understand the PETA thing, but I'm still eating chicken and I'm still eating
it's really
whatever.
good.
And liking it.
Maybe we should pay the extra bucks for the.
Well, I do with the eggs. I do that.
Definitely do with the eggs.
I feel like
So
I'm
do
doing something. I don't know what I'm doing. I don't know if it's just something to make me feel better. And you think about farmed. We worry about overfishing the oceans, but then they say, well, farmed fish is bad. And it's like, well, then what the hell? Can't eat fish either.
Kind of tastes better to me, farmed salmon.
Really?
Yeah, I like farmed salmon.
Do you? Okay. Well.
Or maybe I just haven't,
And
I like the least healthy salmon.
If you eat salmon every day, then you got to get your mercury levels checked. It's just like you can't win. So just eat whatever and do be a nice person in your real life, and
Check your stupid nuts.
Check your stupid nuts for lumps. Quit smoking. Get off your asses and get some exercise. We'll see you in 1 week for the next edition of Weird
Goodbye,
Medicine.
everybody.
Thanks, everybody.
Okay.
That's like me yelling, "Move to adjourn" at the beginning of a meeting at work. All right, very good. Thanks.
Good stuff.